Good evening, everyone. I hope everyone is having a fabulous Thursday, thankful Thursday. We have a lot to be thankful for. So, wherever you are, well, first of all, let's take care of housekeeping. Please make sure you share this broadcast. This is going to be short because I don't have a guest today, but we have some important news to talk about. So, please share the broadcast. If you don't already been share it, you will miss it and you'll have to watch it recorded because this is going to be quick. So, in case you hadn't heard, there have been some terrible Canadian wildfires, and they are starting to affect non Canada. So they're starting to affect the United States. Unfortunately, New York has really been hit. And if you've seen any pictures of New York, they look like they have that sepia because that's how bad the sky is. Um, I had a friend in DC. Their child was supposed to have a picnic for the end of the school year. They had to do it inside because that's how bad the air is. So, I want to tell you just a little bit about health wise what this means to us. First, I want to tell you that 1 hour outside in that is equivalent to smoking half of a cigarette. FYI. So, I think you should probably go get your masks, and I'm going to tell you, you probably want an N95 mask. Um, so respiratory issues, obviously, is the first biggest thing. Wildfire smoke contains fine particles, gases, toxic pollutants, carbon monoxide, nitrogen oxides, and volatile organic compounds. And breathing in these pollutants will irritate the respiratory system, leading to coughing and wheezing and shortness of breath, hint, hint, asthma. Not a good thing to have right now. Chest pain, and of course, like I just said, exacerbation of your asthma or other pre existing respiratory conditions, chronic obstructive pulmonary disease, other stuff like that. Heart problems. The fine particles in the wildfire smoke can enter your bloodstream and cause inflammation, leading to increased risk of heart attacks, strokes, and other heart issues. So, especially for people who have a pre existing heart condition. So, if you're somebody who's on blood pressure medication, um, you have a pre existing heart condition. Eye, nose, and throat irritation. Smoke from the wildfires can cause irritation and inflammation in the eyes, nose, and throat, and the sinuses. So you might have redness, itching, watery eyes, sore throat, congestion, and a runny nose. Aggravation of the chronic condition. So that's what I was talking about with the asthma. So people with pre-existing respiratory conditions such as asthma, chronic obstructive pulmonary disease, or allergies are particularly vulnerable to the effects of this wildfire smoke. So you really need to wear a mask. And honestly, if you can, wear glasses too. That'll help keep it out of your eyes, okay? Mental health impact. The wildfires can cause significant stress and anxiety among affected populations and leading to mental health issues, displacement, loss of homes, and concerns about safety and air quality can contribute to feelings of distress, depression, and post-traumatic stress disorder. And of course, our vulnerable populations. Certain groups, including children, our elderly, pregnant women, and individuals who have a compromised immune system are more susceptible to health effects of the wildfire smoke. They may experience severe symptoms and have a higher risk of complications. So please, if you heard nothing else I said, wear a mask when you're outside if you're in one of these areas. So please pay attention and please visit allergyasthmanetwork.org, click on weather index, and you can see they'll give you information about pollen, flu, and asthma index, I think. So that'll tell you about the air quality and where you are, like where it is. So if you missed the news, go check that out. That'll give you some information. But otherwise, check the news to find out where your area is because it seems to be moving west. I hate to say it. Hopefully, it won't hit Chicago or Detroit. But yeah, it seems to be moving west because, as we said, the East Coast has already been affected, and some parts of the Midwest already have been affected. And I guess they're already predicting some things this weekend. So if it gets under control by this weekend, then I guess next week we don't have to worry about it getting too much further west. But who knows? But I hope this has been helpful. And please, 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 if you have any questions, let us know. And I will see you again soon. Bye.